Hello everyone, welcome to another video from Exam Ready Radiology, where we will be discussing a very effective 4 to 6 month plan for IMM written exam, and we will be discussing important resources, the important timelines, as well as some tips and tricks that are really helpful in clearing your exam in first attempt. So, about this exam, this is basically a CPSP based exam which is conducted in the mid training. After 2 years, you're eligible for this exam, and there are some other prerequisites for this exam as well, which I will be covering in some of my next videos. This exam guideline is ideal for those who have only 4 to 6 months to prepare for their exam. And ideally speaking, when I started for this preparing for this exam, I tried to follow every advice that I got my hand on, and actually, that made me even more confused and made me realize that I wasn't being very uh, strategic, and I wasn't very clear about my goal as well as about the things that I was studying, and I wasn't actually getting anywhere with this type of preparation. So, according to my understanding, there are two types of students, the quick passers and the deep learners. And the quick passers are those who are very intelligent, that in a way that they can quickly do the practice books, revise those, and build a strong grip on how to attempt an MCQ paper. And most of them can get through the exam. And the second category, the deep learners, well, they are the slow learners. They are the learners who like to go into the depth of anything they are studying, and they like to build the knowledge. And in this process, they actually do get some good foundation of anything that they're studying. But for the exam, especially when you have less time in your hand, that can be a bit risky as well. So there are pros and cons for both types. So what works? Well, ideally, we have to follow a very smart approach. What actually works is that you try to build your concepts, you try to practice for the exam, and you continue to combine these both ways very smartly. So, this is the way that I have devised, and this is the way that I have always practiced, and this always helps. Okay, so first of all, the resource list that you need to have before starting your preparation. You should get a very good theory book. Ideally, there are two short theory books that are very good, and these are concise but have excellent knowledge. These are Core Radiology and Crack the Core. And for Crack the Code, there are some supplementary videos as well. And to my understanding, I like it because it's more memorable and the videos are very nice and they help you grab the knowledge as well as make your bases and concepts good. And the ideal thing is that it's a small book, not a very big theory book. So you can revise it as well as you can memorize it. Core is also very good. It covers all the basic and very important topics. Most of the radiology topics that basic level trainee should know are covered in this book as well. So read both and try to choose wisely which suits you. Secondly, we have physics and anatomy. There are some resources that are purely designed for IMM written exam, covering physics and anatomy. For both of these, there are some MCQ files. There is a diamond anatomy file, as well as we have Asad IMM book, which is basically a book made of past papers, as well as it has summaries of all the chapters too. So it is also good for practice as well as revision. And then we have practice books. Now there are around I must say 5 practice books. There is Masterpass, there are Oxfords, there is Get Through FRCR 2A, there is a Curie's to FRCR 2A book, and then there is a Grainger's book. These are all basically designed for FRCR 2A, but now CPSP has also devised MCQ system, which is very similar to the method MCQs are given in 2A or are structured in these books. So these are excellent to practice as well as simulate some exam scenarios. And lastly, past papers. These are very important, and at least last 5 years past papers must be done by everyone appearing in the exam. Coming up next, I have devise a timeline. This is something that worked for me and for the people that I tried to guide them when they were having their exams. And why I like this is that it doesn't leave anything. It builds your knowledge. It makes sure that you practice as well as it is good for revision. So we have a 4 to 6 month plan in which there are around 3 phases. I always divide my timeline for exam preparation in 2 to 3 phases. So first is for foundation, second is for practice and preparation, and third is for final sprint, the final exercise. For foundation phase, you will be doing a theory book. You should be doing a theory book. And if you're doing Crack the Core, you should try to do it with its videos. It's very much doable and very memorizable. So do try to read one of these. Then, whenever you are doing a region, follow that with the Masterpass MCQs. Now, but I think that radiology should be studied region-wise. It actually helps you to go in a flow and keep things very systematic. So read one region from any of the theory books. Try to cover that region in maximum 1 to 2 weeks, and then give yourself some 1 to 3 days to cover Masterpass MCQs. There are around 3 chapters per region, and one chapter of the Masterpass contains 70 MCQs. So it is extensive, but it is very helpful to revise everything, or if there is something missing, that will be covered in these MCQs. And a very important advice, start making notes from day one. This is a key advice. You won't be able to reopen this book, maybe till the exam, or maybe even after, when if you're trying to appear in any other exam like FRCR 2A in near future. Then I believe that such notes are very helpful even to revise for that big exam as well. So try making notes, especially of the things that you are missing, you are finding difficult, or these are not covered in the theory book, but you found something in the MCQ book, and you need to remember that. Then must try to make notes from the theory book as well as from the MCQ book. Now in phase 2, I advise that you try to do all the practice books, but before moving on to other 4 practice books, at least try to do 3. Before trying to do practice books, try to give 10 to 15 days to anatomy and physics. In this way, you will have a feeling of satisfaction that you have read all the syllabus for at least one time, and you have around 1.5 to 2 months before your exam. So this gives you a peace of mind that yes, I have done a big book for practice. I have done all the theory, and now only I need to polish my knowledge or practice. So give yourself 20 to 25 or 30 days for practicing from the rest of the MCQ books, at least 3 or ideally 4. There were left 4, and then in the last few days, ideally 10, 15, or maybe 20 if you're very fast, to try to do revise Asad Ali, which is a book made from past papers. As I mentioned, it has some key points as well as MCQs. So it's a good book to revise and consolidate. This is the final phase, as we already discussed. So after Asad Ali, try to do past papers, which are actually must. So must do past papers, and give yourself at least 3 to 5 days right before the exam, or maybe you can do these a bit earlier and revisit the questions that you found difficult or you were missing. As I mentioned, also add such things in your notes. And lastly, if you there during the preparation, during the practice phase, you found some gaps in your knowledge, or some areas were not being very clear from the books, to give read from Radiology Assistant or Radiopedia. Radiology Assistant has excellent articles on anything like interstitial lung diseases. If you're confused, just give a read to the topic from that website. It will surely clear each and every concept that you need for your practice as well as for your exam. I really like this resource. Now, this is the main thing that I believe makes the difference in any exam preparation. The strategy, the approach always is the most important thing while you're preparing for anything. So as we have already discussed, make notes, organize, pay your theory and MCQs, follow online resources, and trust the single read and trust the process. Once you know that you have put in so much effort, there is always a feeling of satisfaction, there is always a feeling of confidence with which you will be approaching the exam. So just keep yourself composed and focused. This will make half of the game. This is all that you need to know, and this is all that you should be following. And you can make your own timeline, you can make your own plans, but trust me, these are the excellent and very well curated resources and carefully tried and tested methods, as well as things that are actually working to clear this exam. So try to follow, or if you have any other question, you can comment and try to share it with anyone who might be needing this. And till then, take care. Bye bye.